Okay. Hello, everyone at Finding Me Again group. This is Emma and the gorgeous Dr. Roisin Mc Hugh. Am I pronouncing that correctly?
That's correct, Emma. Thank you for inviting me to talk.
It's like, honestly, we are so grateful that you've come along to have a chat with us today. Roisin is a GP, but she specialises in dermatology. Has had an interest in women's health for many, many years, and is part of an amazing team of women called the Menopause Consultancy, which some of you ladies may well want to contact at the end of this chat. We're going to keep it fairly short, only because Zoom are utter bastards and have put me in a right tricky position because, of course, typical Emma, I have not prepared. However, let's go with it. So, with Roisin here, Roisin is a specialist, or focuses her attention with the menopause on skin problems. Now, personally, I did not realise, I don't suffer from skin problems, apart from I've broken out into a load of spots around my face recently. But some of the questions, and I'm afraid, ladies, we're going to have to sort of consolidate a few of them. The words itchy, dry skin come up a lot. Is that associated with the menopause?
Yes, Emma, it is. But I think the first thing I want to say whenever I talk about the menopause is that the menopause is a natural event. It's not a disease. So, and some women go through it straightforward, no problems. Other women, it can be quite traumatic, disruptive. They have a lot of symptoms. It can affect their family, the relationships, work, everything. And I think the important thing, and what you're doing is fantastic, is getting the information out there so that those women can get help and then can have a straightforward menopause as well. So that's the first thing I always like to say about the menopause before saying anything else. And a lot of women will go to their GP with the typical menopause symptoms that they know about, like hot flushes, aches and pains, night sweats, joint aches, all of those. But they may not automatically think that the skin problems are related to the menopause. So, but I think if you look back over a woman's life, anytime there's hormonal changes, so puberty, you can get acne. Starting on the oral contraceptive pill, women sometimes will get melasma, which is pigment changes. And then during pregnancy, women become aware of skin changes. So that's exactly the same in the menopause. Skin changes can be related to the hormone changes of the menopause. So, estrogen itself is really important for the development of collagen. Now, collagen is it's a supporting protein in the skin. It provides strength and structure. So if the estrogen levels drop, then the collagen is affected, and the skin becomes, well, more fragile, less mobile, thinner. There's increased water loss. So that leads to dehydration. The barrier function of the skin becomes less. Skin then can look a bit tired, develop fine lines, wrinkles that we're all aware of, decreased elasticity, more likely for bruising. But the dry and itchiness is a common complaint. For some people, that goes as far as having like abnormal sensations in the skin, so prickling, tingling, feeling as if something's crawling on the skin. But also acne and pigment changes. So another thing that happens in the menopause is that the melanocytes can change. So throughout the body, you might have decreased melanocytes, so decreased melanin. So that reduces the protective effect of the skin to the UV rays. UV rays obviously cause skin damage and can dry out the skin. But also in some areas of the skin, like the face and the back of the hands, you can have increased melanin, which can cause little dark spots or light brown spots. We call them age spots or lentigo. So the dryness in the skin, it's directly affected by the drop in estrogen and the itch. So it is really important to think about what products are going on your skin, and that goes from laundry products. So really making sure that you're not washing your clothes, your bed clothes, your towels, all of your clothes in harsh, toxic laundry products, but also using a good moisturizer or emollient on the skin. Maybe covering the body with an emollient before the shower and then again after the shower. Not having a really hot shower. being aware of things in the environment, like not having central heating on too hot, making sure drinking plenty of water. The emollient itself improves the barrier protection of the skin, but also reduces that water loss and protects that epidermis layer. I mean, and the other thing, obviously, with all symptoms of HRT, of the menopause, HRT helps. So if you replace that estrogen, it's automatically going to improve this collagen. It's going to improve the skin hydration. Skin in women that go on HRT, they may go on it for various symptoms that are troubling them, but they will comment that their skin is brighter, the texture's better, it feels firmer, plumper, the elastin, the collagen improves. So it reduces that sort of aging of the skin. I don't know if that helps, Emma.
Oh my goodness. I tell you what, I have learned more in the last 5 minutes about skin and why, because, yeah, I mean, you've basically covered an enormous area of the questions that we've got, because obviously, ladies on the Finding Me Again group, thank you so much. We had about something like 35, 40 questions, which we obviously can't field, but I think you have covered, because you've given us an idea of what is going on. When you say emollients, is that just a general moisturizer? Would you recommend something that is without perfume? Is an emollient just a general moisturizer?
So when we talk about emollients, they're moisturizing products that we use in skin conditions such as eczema, psoriasis, and various other skin conditions, and they're not perfume. That's the really important thing. I mean, there is so many different brands. There's like Dip Revace, Aveeno, Double Base, just loads of different brands, and they're all used for eczema. So you could go into your pharmacy and just ask for a treatment that's used for eczema, and you will know that that'll be gentler on your skin than your typical perfumed moisturizers that you might use. That smell lovely, but they will be irritating your skin.
Right. No, that's great. And
that's important. Sorry, and just to mention, that's important as well. Sorry to interrupt you, Emma, but not to use soap on your skin, because soap dries out the skin. So your normal shower gels and soaps aren't good for your skin. You're better literally just to put the emollient on before you go into the shower, and then just wash it off and replace it again when you come out.
Because skin, generally speaking, is self-cleaning, isn't it? It doesn't. It's just sort of certain areas, like under your arms, you might need.
Yes, well, smelly.
Yeah, the little bits that need a bit of extra help. Yeah, and one of the questions the ladies asked is that itching can be worse at night. Is there any particular reason for that?
Yeah, well, that can often occur because other menopause symptoms can sometimes be worse at night. So like the night sweats can lead to dehydration, and if you're dehydrated, then your skin's affected. So although you're sweating and it feels, you may have drenched with sweat in your skin on the surface, the actual skin itself could be dehydrated underneath that, and the barrier protection is down, and then the itchiness will start, and the hot flushes will make all those, if there's any kind of tingling or sensation changes in the skin, they would be worse at night with hot flushes and with tiredness. Every symptom is worse with tiredness.
Yeah, and I think I mean, I've always been a great advocator of if you've got any problems during the day, they are 400-fold at 2:30 in the morning.
Exactly.
In fact, they're almost definitely life-threatening. But when you wake up in the morning, if you actually do get any sleep.
Yeah, and another thing is that your natural body steroids, they dip overnight. So the steroids that might be keeping you from scratching and feeling itchy during the day will reduce during the night. So that's in keeping with all, like asthma, for example, sometimes can be worse during the night because the natural body steroids dip during the night. So that's why these things can sometimes be worse during the night.
So it's probably worth having a bit of a little bit of an emollient massage, or somebody covering you with a lovely cream just before you go to bed to try and prevent that.
Yeah, you make it sound lovely.
Yeah, trust me, my husband wouldn't bother. Yeah, if anyone else got a nice husband that would do that, then definitely. One of the other ones that obviously in terms of emollients, eczema on the scalp, itching on the scalp, it's pretty tricky to get an emollient there. Is there any particular thing you would recommend for itchiness on the scalp?
Yeah, so on the scalp, if there is itchiness on the scalp, it is most likely like a seborrheic dermatitis on the scalp. And this, there can be a fungal element to this. So sometimes an antifungal shampoo like ketoconazole can help, but or also a tar-based shampoo can help. And this is this often can get a bit worse during the menopause. So there may be underlying inflammation and scaly patches on the scalp, which can be helped by a topical steroid lotion. So both of those can help. And the important thing is not to wash the hair too frequently. So if you're using, for example, a tar-based shampoo or an antifungal shampoo, use it twice a week and don't wash the hair every day.
Right. No, that's brilliant. And one of the other ones, rosacea. I know it's something that doesn't get mentioned very often, but I had a girlfriend who suffered so badly from it that she refused to go out, because we think of rosacea as just redness of the skin, but it's so much more than that, isn't it?
Yeah, so rosacea can sometimes get worse as well during the menopause, because flushing is a big factor in rosacea. So if a woman is already experiencing flushing from rosacea and then gets hot flushes on top of that, and may have like superficial blood vessels, especially around the cheek area, called telangiectasia, that can be broken, and these can give the appearance of flushing and redness to be more severe during the rosacea flare-ups as such. But you also get like papules, little red spots with rosacea, and it can even have more severe rosacea can affect around the nose and the mouth area. So and sometimes even have bits of dry, flaky skin associated with rosacea. I think the important thing with rosacea is never to use a topical steroid, because that will initially maybe make it look a little bit better, give a bit of relief, but it will make the flare-up so much worse. So stay well away from topical steroids. There's various things like topical treatments that can go on the skin, and if it is more severe, then a topical antibiotic such as metronidazole or even oral antibiotics can sometimes be required. The broken blood vessels, the capillaries, sometimes will need laser treatment. But again, yeah, it's the hot flushes can make this all a bit worse. So, and the hot flushes are a result of the estrogen deficiency, which again can be helped with replacing that estrogen with HRT.
That's fantastic. And I mean, from the sounds of it, and obviously the rosacea is, I would think, probably a much more extreme version of poor skin, or a bad skin problem during the menopause. Probably a good recommendation would be to visit somebody like yourselves at the menopause consultancy to see a specialist, because they can sort that with some amazing products or amazing medicines that can actually change your life. I love what you said at the beginning of this, which is, like pregnancy. Pregnancy is not an illness, although I made it sound like it was. I can absolutely assure you, I took full advantage of not moving for 9 months. It isn't an illness, and it should be a time of life that we're celebrating. We've done our bit for humanity, and here we are. And yet, so many women are struggling, and the skin thing is actually, hot flushes and the main problems are obviously of importance, and we will talk to another one of your colleagues about those and other symptoms. But in terms of skin, it's actually a very personal thing, isn't it? It's a bit like hair. If you're having a bad hair day, you don't really want to see anybody, you don't want to go out, you certainly don't want to socialize. And to have a skin problem is incredibly personal for a woman, because our skin, that's why we wear foundation. Why would we bother with foundation and skin products if we didn't care about our skin? And so I really think it's very important at this point to say, if you are suffering from debilitating skin problems, go and see, or get in touch with someone like Roisin at the Menopause Consultancy, because they can help. There is help out there. Don't suffer in silence. Have that conversation.
Yeah, I think it is definitely very personal, and I think that's why it is important to speak to someone, as I said, at the Menopause Consultancy, or even your own GP. There is help out there, and not to suffer in silence. That's exactly right, because if you're uncomfortable with your skin and how especially your face skin looks, or if you're feeling itchy, it's going to you're not going to want to go out, and it's going to affect your whole self-esteem. And lifestyle factors need to be looked at as well. Obviously, menopause affects how we react to things. So a lot of women will say, well, I used to be able to have a glass of wine in the evening, now I can't. It affects my sleep much more. And again, wine and alcohol can affect rosacea. It can cause a flare-up. But other foods such as cheese can cause flare-ups of rosacea. So there is other things to be discussed around the whole topic of rosacea. And as I say, there is prescribed treatments that can help. And, you know, if it makes you feel better about yourself, helps your self-esteem, helps you to get out a bit more, helps you to feel better in your relationships at work and everything else, then it's definitely worth asking for help.
Yeah, no, couldn't agree more. And someone was mentioning about cyst-like spots. Is that normal? Is that something to do with the menopause, or possibly something completely different?
So that again could be, yeah, it could be related to the menopause, but also because acne can flare up. So the same as when you're in your teens, acne can flare up. Again, with especially in the perimenopause, because the estrogen levels are so erratic. So there might be times where there's high estrogen, then low estrogen, and that can affect the acne in the skin. But it also, so that's the cyst-like spots are acne type spots. But also at the beginning of the menopause, there'll be a drop in estrogen, but in comparison, there might be an imbalance between estrogen and testosterone. So that can affect it. If you are getting spots, if you have other symptoms, so if you're worried about your period, you have facial hair, any other symptoms you're worried about, you should definitely discuss it with a doctor, because there could be something else going on, you know, polycystic ovaries. There's various conditions that sometimes a skin symptom can alert the doctor to something else going on underneath that needs to be addressed. Yeah, and skin, even something like thyroid, you could have hypothyroid causes dry skin. So if your thyroid's too low, if your thyroid is hyper, if you have too much thyroid hormone, then it can cause more oily skin. So it is important that don't sort of think, oh, it's just my skin, I can't go to the doctor with it. It is important to discuss it. And I think more recently as well, with wearing masks, we've all become aware that they can affect the skin because they're rubbing on the mask's rubbing on the skin, so it can cause a flare-up of acne symptoms. It's really important to put on your moisturizer and emollient as a barrier to protect the skin. Let it dry in for about 30 minutes before putting on the mask. Try not to touch the mask, because if your hands aren't clean, then you're touching the mask, which is then rubbing on your face and the friction. Also, you try and avoid synthetic materials in your mask, so try and go for more natural materials like cotton or silk, and wash them in, you know, like a natural washing powder or liquid laundry detergent at about 60 degrees, and keep replacing your masks instead of wearing the same one every day. And then obviously the bacteria builds up on it, it rubs on the skin, and then the heat and moisture underneath the mask, it all increases the risk of getting acne like spots and cysts. Yeah.
Wow. Yeah, I hadn't even thought of that.
But
yeah.
Still wear the mask. That's important. I'm not saying
yeah,
don't
no, and I
wear
think
the mask.
this is going to be our new normal, isn't it?
Yeah.
Yeah. And just one last question about skin. A lady here used to suffer with sebaceous eczema on her scalp. She is currently taking Novotel and amitriptyline, and has now got dry, weepy sores on her scalp. Should I ask for? Oh, she used to use Betnovate scalp application. Should I ask for this again, or is this something else to help with? Are we going back to the shampoo again?
So that's back to what we were talking about exactly. It's so sebaceous eczema or seborrheic dermatitis on the scalp causes inflammation. So you may get simple like dandruff-like symptoms, but also scaly patches on the scalp that can be very itchy and very painful. And the Betnovate scalp lotion will help. The shampoo. Some people, it may be so severe that especially if they have like a folliculitis, like an infection of hair follicles developing, they may need antibiotics. So again, don't suffer in silence. Speak to a doctor about that. Yeah.
Yeah. No, that's great. And the one that is just bothers everyone including yours truly, and you can just skim the surface of this one. But weight gain, oh my God, I am the fastest inflating woman on earth. I've never had a particular problem with my weight, but I've never known anything like it. It's extraordinary. Is there anything we can do? I mean, obviously, is there anything we can do to prevent gaining 15 pounds just by looking at a cake?
So, well, after the age of 40, our basic metabolic rate reduces. So if we eat the same and exercise the same, we will put on weight. So that's unfortunate. That's the bad news. The other thing is the fat distribution changes. So as our estrogen levels drop, the fat distribution is central. It's midriff. Whereas before it might have been more evenly spread. It's now midriff. So a woman then might find she has to go up a dress size to fit around the waist, and then maybe it doesn't fit elsewhere on the body. So that's disappointing. But the important thing, another thing, is that muscle mass reduces. So again, a woman's body shape does change, and that again affects self-esteem. So I think in terms of exercise, yeah, exercise is still really important, but it's important to not just do, it's important to do weight-bearing exercise to protect your bones, but also resistance type exercise. So don't think, oh, resistance can be weightlifting, but it can also using your own body weight. And don't think, oh, that's just for bodybuilders. It is important to improve your muscle mass. Muscles need estrogen, so women that go on HRT and replace that estrogen find that their muscles do actually respond better to exercise. So I think in going with that, yeah, it is a problem. Some women worry about going on HRT because they think they'll gain weight if they go on HRT. But the studies do show that there's no scientific evidence that HRT causes weight gain. In fact, you'll sleep better. You'll be more inclined to not to comfort eat because you're not as fatigued, and you will think more about a healthy diet, be more inclined to exercise, and then the muscle will respond better to the exercise because of the estrogen. So yeah.
Do you know what? And I'm just going to interrupt quickly. It's because you've hit the nail on the head. I've done quite a lot of studying about this just for personal reasons.
Mm-hmm.
And I think you're absolutely right. Building up muscle, not just in your legs, but all over. Because muscle, when you're sedentary, burns fat rather than if you've got fat. So your muscle actually uses up energy when you're sitting still. So the more muscle we can build up, and as you say, it can literally just be a general building up your leg muscles whilst you're sitting down, etc. But Roisin, I've taken up far too much of your time already. You have been amazing.
Thank you. It's been a joy talking to you.
Oh no, do you know it's fabulous, and I think what you said at the beginning, I think ladies have got to take massive comfort in this, and I think this is something that we want to strive towards in the Finding Me Again group, is that this should be a celebration of the release of what we've done for humanity, and now it's our time, and it's not an illness, although it can feel like one. And I think the tragedy of that is ladies struggle to find the information. Well, we're giving that to them now. Please, ladies, look up Roisin, look up the Menopause Consultancy. They are an amazing group of ladies who they have your well-being at their heart. And let's start enjoying our life now. It's time for us, and I know that many of us are struggling. We will there'll be lots of other chats about emotional and psychological impacts of the menopause, but with all this we're going to arm you all with some amazing information, and we've hit the skin, which I think you've been fantastic. Thank you so much.
I should just mention as well, we've been working with the People With app, and if anyone wants to download that, it's a way of recording. A woman can record all her symptoms, so it just makes things a bit clearer for her. She can see the pattern of her symptoms, so she can see, for example, if there's stress or different lifestyle factors affect her symptoms, or if she goes on medication, if it affects her symptoms. But it also helps the practitioner. So if she goes to see a doctor, she can have everything clear on the app and print out a report and show it to the doctor, and it just makes the discussion a bit easier.
It is a mind-blowing thing. I've been talking to the ladies on here about it, and I'm sure they think I'm completely bonkers, but it's lovely to hear it from a medical practitioner. I'm just going to say it again, ladies. People with on the App Store, it is your health in your pocket, and it's invaluable, and it's the future. The way that's the way I see it. You know, we start getting health profiles, you know, sort of pocketed, and we can, you guys can start treating ladies much more efficiently, and know exactly what's going on with them. But thank you so much. So yes, the menopause consultancy, the lovely Roisin Mc Hugh.
All right.
People
Thank you, Emma.
Thank you so much. I
Thank
will
you,
catch
Emma.
up with you
Bye-bye.
really, really soon. Take care from all of us at Finding Me Again.
All right. Bye-bye.